The branch of pathology that I use most frequently is cytopathogy. So I work in an STD clinic, and I work in the lab as well as with the patients. So we see both males and females. We do urethral swabs on the males and endocervical and vaginal swabs on the females. And then occasionally we'll do pap smears. We send those off to our lab, but we do a swab for trichomoniasis in our lab, and we look under the microscope ourselves. So we're able to see if they have trick and let them know. We can also detect yeast and bacterial vaginosis, but we're mainly looking for trick since we're an STD clinic. And if we find trick, then we are able, the PA that I work with is able to prescribe the medication, because there's only one medication that treats it. So if you have like strep throat or something, that antibiotic is not treating the trick. So you have to be careful if you're pregnant. So there's some different questions we have to ask, and sometimes they have to go take a pregnancy test to make sure they're not pregnant before she prescribes that. But it's really neat to look under the microscope at it. I don't know that I would want to have a job in cytopathology where I'm just looking at the microscope all day, every day, looking at pap smears and not seeing the patient. But I love that I get to see the patient in the presentation, and then I get to look under the microscope and then go back to the patient and tell them what we found. So it's been really rewarding and super educational to be able to learn about this area of microbiology and the pathology side. So I also do the blood draws. I run the lab there, and so we'll do blood draws for HIV and syphilis. We do send those off to our lab to run the reports and things. So there's a cytopathologist on the other side of that, looking at our pap smears and our blood and things. But it's been really educational, and I've enjoyed learning about it. Specifically the trick, because most people have not heard of it. So I tell people it's like lice in a kindergarten classroom, and it spreads about that quickly. So if you go to your school nurse on a Monday and you have 2 bugs in your hair, she may not see it. So sometimes you have to wait for them to multiply in order for it to be noticed. So she might have you come back on Friday and you have 40 bugs, and then she's able to diagnose you with lice. So trick is not in hair, it's in fluid, but it's microscopic and super hard to detect in guys. So I tell my sexually active female patients, just assume every guy has trick, because they may not know that if they have it. They're often asymptomatic. And so anyway, it's been neat to be able to educate others on it, and to also be able to look under the microscope and get to see it for myself. So cytopathology is where it's at.